Yes, Majority Leader.
Honorable Speaker, thank you. I have diligently looked for the CS and finally found him. And he is in the House, and I would like to cordially present him to you so that he can start the business of the day. Thank you, Honorable Speaker.
CS for Health, Honorable Duale. You're here on the direction of the Speaker to speak to the House and the country on the issue of Ebola and the raging debate about it. This session will be exactly 1 hour. This is an allotted day. It is now 2:46. At exactly 2:46 members, we will stop. 3:46, we'll stop on this issue. So we'll allow the minister to deliver the statement to the House. Thereafter, I'll allow comments, questions to the minister. And at 3:46, we'll discharge him to go back to our allotted business. Minister, welcome.
Mr. Speaker, honorable members, I thank you, Honorable Speaker, for giving me this opportunity to appear before this House and to provide a report on Kenya's preparedness and containment and management of the threat posed by Ebola virus disease, following your directive during the plenary sitting of the 2nd June 2026. I also acknowledge the concern raised by honorable members regarding the possibility of Ebola virus disease importation into the country, the establishment of a quarantine and isolation centers in Kenya, the preparedness of public health facilities, and the nature of the regional and international coordination mechanism. From the onset, I wish to assure this House and the people of Kenya that the country has not recorded any confirmed case of Ebola virus disease as of 3rd of June 2026. The government is, however, treating the regional outbreak with the seriousness it deserves, because Ebola is a severe disease with high fatality and huge public health threat. And Kenya's position as a regional aviation, trade, transport, and diplomatic hub places the country at increased risk of importation of the disease. Honorable Speaker, the epicenter of this outbreak is in DRC and Congo. As per our last situational update, the Democratic Republic of Congo has reported 1,083 suspected cases and 259 deaths. Of these, 321 cases are laboratory confirmed, with 48 confirmed deaths. A total of 2,746 contacts have been listed for follow-up. Uganda has reported 12 confirmed cases and 2 deaths, with 642 contacts listed for follow-up. Honorable Speaker, this disease is associated with the Bundi species of Ebola virus. This is significant because there is currently no approved vaccine for this particular virus or for this particular species. The outbreak has also affected healthcare workers both in DRC and in Congo. In view of the regional risk, the WHO declared the outbreak as a public health emergency of international concern on the 16th of May 2026, while Africa CDC declared it a public health emergency of continental security. These both declarations by WHO and Africa CDC signals an extraordinary public health event that poses a risk to other countries and requires a coordinated international response. Kenya has therefore activated the National Preparedness System in accordance with our constitutional duty to protect the right to health, our obligations under the Health Act 2017 and the International Health Regulations 2025. Honorable Speaker, before I respond to the many questions that you have asked me to answer, let me just give the country what is Ebola and which type of Ebola is this. Ebola is a severe, often very fatal illness in humans. There are 3 different types of species. There's Ebola, Zaire, Sudan virus, and the current one we have, which is called Bundibugyo virus, which has the capacity to cause large outbreaks. The modes of transmission are many, Honorable Speaker and members. The infection index from contact to the wild animals. Thereafter, transmission occurs from person to person through blood or bodily fluids from infected persons or dead bodies. Transmission can also occur from contaminated surfaces or objects like bed linen and clothing or unsafe injection practices. What are the early signs and symptoms? The average incubation period of this particular virus, Ebola virus, is between 2 to 21 days. Infected people are not contagious until they develop the symptoms. Initial signs and symptoms are non-specific. Many common infections, like other diseases like malaria, typhoid, meningitis. But the symptoms are usually of a sudden onset. They include fever, chills, headache, joint pain, muscle pain, backache, nausea, vomiting, diarrhea, fatigue, weakness, skin rashes, among others. Bleeding is less frequent and can occur in the later stages of this disease. Who is at risk of infection? Travelers to the affected countries like DRC and Uganda, contacts of travelers from the affected region, family members of the Ebola virus diseases, healthcare workers taking care of the patients with Ebola, or people handling bodies of Ebola victims. How do we prevent Ebola? Early identification and prompt referral and isolation of the suspected cases. Basic universal precautions of hand hygiene and gloving in health setups during the routine work. Wearing of the full personal protective equipment when handling cases or suspected or confirmed Ebola. And finally, to avoid contact with the bodily fluids of suspected cases. Honorable Speaker, allow me now to address the questions that appeared on the letter you addressed, and the first one was the measures by the government to manage and contain the threat of Ebola. Honorable Speaker and members, the government has activated a whole government preparedness and response framework led by the Ministry of Health through the Kenya National Public Health Institute. The National Ebola Incident Management System was activated on the 20th of May 2026 in order to provide a unified central command, coordination, and decision-making. This structure is supported both at the national and county public health emergency operation centers, which remain on high alert mode. 2, under this arrangement, we have also strengthened our surveillance of health facilities within our communities and the points of entry. We have issued advisories to all the 47 counties covering Ebola case definitions, infections prevention, control reporting protocols, guidance on isolation, sample referral, contact tracing, among others. Our rapid response teams, Honorable Speaker, have been placed on standby for deployment where alerts are reported. Government has also enhanced screening at our 26 official points of entry, including our international airports, land border crossings. As of yesterday, 2nd June 2026, 71,243 travelers have been screened cumulatively, including the 2,506 travelers who were screened in the last 24 hours. Screening focuses particularly on travelers from the affected countries and high-risk travel routes. To date, Honorable Speaker, the national surveillance system has captured and investigated 22 suspected alerts from across the country. All of them have tested negative. These alerts were reported from Nairobi, Kiambu, Uasin Gishu, Nyeri, Nakuru, Nyamira, West Pokot, Kisumu, and Bungoma. In the last 24 hours, 3 alerts from Nairobi, Uasin Gishu, and Bungoma were investigated and they were confirmed negative. Honorable Speaker, the Ministry has also operationalized the public communication mechanism, including the national number, toll number 719, which is our public health hotline, to facilitate communities to report, to do public inquiry, and to give health advisory. Public messaging is being disseminated through the national and the county channels in order to educate the public on the risk factors. Honorable Speaker, the second area you told me to address through the letter from Parliament was the preparedness of the public health facilities, the isolation units, the medical facilities, and trained personnel. Honorable Speaker, the House specifically requested a report on the level of preparedness of public health facilities, including isolation units, medical facilities, and trained personnel. And I want to confirm that the Ministry of Health has undertaken facility readiness assessment and continue to strengthen capacity at the national referral facilities and in counties considered at high risk. At the national level, Kenyatta National Hospital has prepared an 8-bed isolation and treatment unit and completed a dry run of how the index case will be handled. The facility has a separate waste management system to support the safe handling of infectious waste. The National Police Service Hospital has been assessed and has 49 beds ready for activation as part of the surge isolation capacity. At the county level, 29 counties have identified designated isolation and treatment sites. The Ministry of Health, the Kenya National Public Health Institute, and relevant regulatory agencies are undertaking on-site verification, quality assurance, spot checks to confirm that these facilities meet the required standard for infection prevention, control, patient flow, waste management, staff protection, and emergency referral. Honorable Speaker and members, these facilities are part of Kenya's national public health preparation architecture. They are not established for exclusive benefit of foreign nationals, foreign governments, or any special category of persons. They are intended to protect all persons within the territory of Kenya, including Kenyan citizens, residents, refugees, visitors visiting our country, diplomats, expatriates, and any other person who may require isolation, testing, or treatment based on the medical need and public health risk. This position is consistent with the Constitution, the Health Act of 2017, the Public Health Act, and the International Health Regulation 2005. If any person, which says if any person is identified within Kenya as a suspected or confirmed Ebola case, the correct public health response is to safely isolate, test, treat, and trace contacts within the jurisdiction where the risk is detected. On personnel readiness, Kenya has mapped a surge capacity of 241 expert responders comprising of 51 epidemiology and laboratory training program, 118 African volunteer health corps professionals, 72 basic health emergency management specialists, and these teams are on standby for deployment to support surveillance, contact tracing, case investigation, laboratory diagnosis, and field responses. Additionally, 1,069 national and county health workers have been sensitized on Ebola preparedness and response through a very structured virtual sessions. On-site training and simulation drills have been undertaken in Busia County and Busia border, where 60 health workers have been trained, and additional exercises are going on. Our plan for the county of Turkana and Trans Nzoia. A national tabletop exercise is scheduled for 15th to 18th June 2026 to test coordination, referral, laboratory, and response. Thirdly, Honorable Speaker, you have asked the measures we have activated as a ministry, which I have really enumerated. Honorable Speaker, in surveillance, the health facility and community-based surveillance have been intensified. Ebola case definitions have been distributed to all counties. Rapid response teams remain on 24-hour standby. Counties have also been directed to identify and operationalize isolation facilities, holding areas, and quarantine facilities. At our points of entry, screening has been strengthened through health declaration requirements, temperature screening, symptoms assessment, and referral protocol. Thermal scanners, holding rooms, ambulance systems are being reviewed and activated in all our priority ports of entry, including major airports and high-volume land border points. On our laboratory preparedness, the virus being an extreme biohazard, 4 laboratories have been designated for Ebola testing. The National Public Health Laboratory, Kemri Nairobi, and Kemri Kisumu, and a mobile laboratory deployed to Busia. These laboratories are equipped for molecular diagnosis with a mobile laboratory positioned to reduce the turnaround time in the border region. However, Honorable Speaker, I wish to be very candid with this House. While laboratory capacity is strong, the current stocks of specialized test kits, reagents, personnel protective equipment, which are estimated to support only approximately the first 200 suspects, are in place now. And this is why additional emergency financing and partner support are required to build a more adequate testing capacity. In infection prevention and control, the World Health Organization has provided 1,000 Ebola PPE kits, which are available in the country and being pre-positioned to support preparedness activity. Initial pre-position is focused on strategic sites, including Kenyatta National Hospital, Kenyatta University Teaching, Referral and Research Hospital, Mombasa, MTRH in Eldoret, Turkana, and other high-risk points of entry. Honorable Speaker, the fourth item was on regional cooperation, coordination with our neighbors, foreign governments, and international health agencies. Honorable Speaker, the House requested a report on that. Kenya is working closely with all the affected and neighboring countries, regional institutions, international partners, because Ebola is not a national problem. It's a regional, it's a global security, it's a global public health security threat. The ministry is engaging in cross-border coordination with our sister country, Uganda, with a particular focus on sharing surveillance information, traveler screening, case notification, contact tracing, laboratory referral, and rapid response readiness. Kenya is coordinating, and we have held meetings at the highest level with the World Health Organization, with the Africa CDC, with the IGAD, with the EACC, with the International Organization for Migration, with the U.S. Center for Disease Control, all these at ministerial level, and with other development partners. This cooperation is focused on surveillance, on laboratory support, on simulation exercise, on technical guidance, training, risk communication, logistics, and partner resource mobilization. And I wish to emphasize, Honorable Speaker, that international cooperation does not mean surrender of our national authority and sovereignty. All public health decisions within Kenya remain under the authority of the government of Kenya. International partners provide technical assistance, commodities, financing, training, and logistical support. Regarding the recent media reports alleging that Kenya has entered into an agreement with the United States of government to establish a quarantine facility for U.S. citizens or foreign nationals, I wish to state it clearly that Kenya and the U.S. government signed an agreement on cooperation in threat reduction, biological and infectious diseases engagement program on the 24th July 2015 during the state visit of our President and President Barack Obama. President Uhuru and President Barack Obama. The agreements were therefore approved by the cabinet then in April of 2016 and subsequently introduced in this House in Parliament, laid on the table of the House on the 19th of July 2016. Upon undergoing parliamentary procedures and public participation and the House process, the House approved the ratification of the agreement on the 9th of February 2017. This agreement subsequently entered into force on 6th of April 2017 and has a validity of 5 years. And Honorable Speaker, the renewing of this cooperation was again signed and came into force on the 5th of April 2022, which the annex I have provided. The extended agreement has a validity period of 7 years and is valid to the 5th of April 2029. Further, on the 4th of December 2025, we again signed a cooperation agreement with the United States of government to strengthen Kenyan healthcare system on our different areas, including digital health, including HIV/AIDS, TB, and malaria. Over the last 23 years, Honorable Speaker, the government and the people of the United States, through the U.S. government health program, has provided close to $8 billion, equivalent to slightly over 1 trillion Kenya shillings in support of the Kenyan health sector. This investment has significantly strengthened our national response to HIV, TB, malaria, maternal newborn, and global health security. The government of Kenya deeply appreciates this long-standing partnership and remains committed to ensuring that the gains made are sustained through the increased domestic investment, strengthened institutions, and successful implementation of the Kenya-US Health Cooperation Framework, which provides a pathway towards greater country ownership and sustainability of our health program. Honorable Speaker, the proposed Ebola treatment and isolation unit at Laikipia Air Base is part of the 23 similar units to be established in the country as part of our preparedness and response. This facility will jointly be run by the government of Kenya and the U.S. government under the command of the Air Force Commander, the base commander, and the entire medical team of the Kenya Defense Forces, working together with the Ministry of Health. This proposed facility reaffirms Kenya's position as a medical hub in the East Africa region with the capacity to offer specialized care for complex infectious diseases like Ebola. I must also inform the House that aspects of the matter relating to the alleged international health agreements and containment arrangements are now before court. Accordingly, and in keeping with the doctrine of sub judice and standing orders of this House, I will avoid discussing the merits of any active litigation. But I will, however, continue to provide this House with the government's public health position and preparedness status. Honorable Speaker, you also asked about the establishment and accessibility of the Ebola disease control and isolation centers. Honorable Speaker, the House asked whether Ebola disease control and isolation centers have been established in the country. And I want to say this. I hasten to add that there is a significant presence of Kenyans in the affected regions of both DRC and Uganda. Many Kenyans work in Uganda and do business both in Uganda and DRC. And two of our leading banks, KCB and Equity, employ Kenyans who live in that region. In addition, Kenya has approximately 450 specialized KDF officers and servicemen who are in DRC under the MONUSCO peacekeeping mission. Any of these Kenyans could be exposed and could require a quarantine and isolation facility back home in Kenya. The government has established undesignated isolation and treatment capacity as part of our national preparedness. These include, I said, our national referral facilities, our county designated sites, temporary holding areas for points of entry, county isolation facilities. These facilities are being progressively verified for quality, for safety, and for readiness. And I want to reiterate that all such facilities are established for the protection of the people of Kenya and all persons within the Kenyan borders. They are not only foreign facilities, they are not for foreign facilities, they are not exclusive facilities, they are not facilities reserved for any nationality, they are public health assets established and coordinated under the authority of the government of Kenya. In the event of a suspected case, the response will be guided by medical triage, exposure risk, clinical need, and public health protocols. A Kenyan citizen, a foreign national, a refugee, a diplomat, an expatriate, or a traveler will be managed according to the same public health principles: safe isolation, testing, clinical care, contact tracing, prevention of further transmission. Our objective as government is to protect communities, to protect healthcare workers, and the country. When a case is detected, the safest place to manage it is within a properly equipped isolation and treatment facility under the controlled conditions. Finally, Honorable Speaker, you have told me to give guidance on the public health guidance. Honorable Speaker, any person who develops fever, headache, vomiting, diarrhea after recent travel to the affected areas or one of their community members after contact with a suspected case should seek medical attention immediately and report through the 719 public health hotline. Honorable Speaker, our readiness assessment gaps and resource requirements are all provided in this document, and I think I have provided the agreements, the documents, but just to conclude, so that I take questions from members, Honorable Speaker and members, it's very important, you play a very important role in the public health protection of our country. Misinformation during disease outbreaks can cause panic, can cause stigma, can delay health seeking and resistance to public health measures. I therefore request members of this House to support the Ministry of Health by amplifying accurate information, encouraging early health seeking behavior, supporting screening at border points of entry, and urging the public to use the official 719 hotline. Honorable Speaker, I want to repeat for emphasis, Kenya has no confirmed case of Ebola virus disease. Our surveillance systems are active. Our laboratories are functional. Our points of entry are screening travelers. Our rapid response teams are on standby. Our health workers are being trained. Our isolation facilities are being verified and strengthened. And the government of Kenya remains fully in control of the preparedness and the response architecture. Our approach is guided by science, the law, the national interest, the public health protection, and the international obligation that, as a country, we have. We will continue to act transparently. We will continue to act decisively. We will continue to respond responsibly in order to protect Kenyans and all persons within our borders. I thank you, Honorable Speaker, and I'm ready to respond to any questions from the honorable members.
Thank you, Honorable Duale. Sarah Korere.
Thank you, Speaker. Speaker, we've had a very elaborative explanation from the Cabinet Secretary. And Speaker, coming from Laikipia, we have a lot of reservations and especially concerns from the people we lead because we are representatives of the people. Speaker, it is clear that this Ebola is rare and fatal disease. And common sense will dictate that if this disease starts in a particular place, it will be natural that you just contain it where it has started. I want to ask the Cabinet Secretary. He has said that the government of Kenya and the government of the US signed an agreement way back in 2015. And in 2019, there was Corona, which was a global problem. We didn't see the US come out the way they have come out now to construct a Corona isolation center or a center to help the Corona people who are infected by Corona in Laikipia or anywhere in this country. And if they have, probably the Cabinet Secretary can tell us. About this Ebola thing, I want to ask the Cabinet Secretary. You know, it's very unfortunate that we saw a US Secretary of State in Washington declaring that they will not allow even one single case of a corona-infected US citizen, I mean Ebola, set foot in America. So if they are infected in Congo, they will not take them to treat them in America, they will not treat them in Congo, they will bring them to Laikipia. And you know, members, allow me to say this. You know, the people of Laikipia, we have never healed from the aftermath of colonization. We still feel that even today we are still being colonized because half of our land went to the British colonizers and it later on went to their citizens, and we have never regained a single inch of the ranches they took from us. And now they want to bring Corona. And you know, I mean Ebola. And you know, I'm just saying because I represent people who are concerned that if Americans are to be flown to Laikipia Air Base to be treated there, what happens if this disease, God forbid, you know, leaks out and probably people around Nanyuki are infected by Ebola? Will the American government take charge and treat the Kenyan citizens the way they would like to treat the American citizens? That is one.
You've made your point. There
No,
are many interests,
let me
Sarah.
finish.
I can't allow you to
Finally.
continue making a speech.
I'm finishing, finally. The concern also is, we have a lot of tourism in Laikipia, and as I speak now, there is a lot of cancellations by the people who are traveling to the lodges of Laikipia. Can the cabinet secretary tell us, how are they going to communicate to the citizens? Because probably most of this mayhem is because of miscommunication. Whose message is it that the citizens are getting miscommunicated by people who are not in authority to give that information to them? Why should the people who are in authority didn't give the correct information to the citizens of Kenya and the citizens of Laikipia?
Thank you, Sarah. Mere Mase. Avoid the temptation to make speeches. Ask questions.
Thank you,
Yes.
Honorable Speaker. Honorable Speaker, and I thank you for giving me this opportunity because I'm from the border to Uganda, and my people are more at risk. My question is, I have listened to the PS, to the CS, I'm very sorry, to the CS. I have a concern. The ministry officials were in Busia County, Teso South at Alupe Hospital with a proposal to convert Alupe Hospital into an isolation center for managing Ebola. Honorable Speaker, I do not have any other hospital to serve the people of Teso South. None. It is only Alupe Hospital. So I want to tell the CS that we will resist, that Alupe Hospital cannot be made an isolation center for Ebola. Whereas I support the government initiative for preparedness to protect the people of Busia because we are at the border, let another venue be identified to build that isolation center, but Alupe will not be converted, Honorable Speaker.
Robert Mbui. Minister, I hope you are recording the members and the questions.
I have to.
Mbui.
Thank you, Mr. Speaker. Mr. Speaker, listening to the CS, he was very clear when he said that Kenya has no cases of Ebola. And Mr. Speaker, the ministry should endeavor to ensure that Kenyan citizens are safe, because that is the purpose of this ministry. Now, we know that Ebola is highly contagious. There is this agreement that he says there is, because of sub judice, he cannot maybe table it before us. But Mr. Speaker, I want to ask him to just clarify. In that agreement, which is between Kenya and the US.
He didn't say that. He didn't say he cannot table. In fact, the
Because
agreement
he has not tabled, Mr. Speaker.
The agreement is here.
Oh, we have it, okay.
Yes.
Or the court case, the matters
He said
that are
he will not delve
contained in the
into
court
matters
case.
sub judice.
So, Mr. Speaker, I wanted to just find out, where in that agreement does it say that we can expose Kenyan citizens at the expense so that we can be able to save citizens of the US? It's very important that he points out that, because in my opinion, I think that cannot have been something that this House would have passed. And Mr. Speaker, finally, I also want him to clarify, is it true that this center that is supposed to be built in Mount Kenya region is supposed to be only meant to be used by US citizens and not Kenyans? He needs to clarify that for us. Thank you, Mr. Speaker.
Yes, Dindi Nyoro.
Thank you very much, Honorable Speaker, for this chance. And direct to the point, I have listened to the CS, and there is actually no space in his speech about the view of Kenyans. I'm yet to meet one single Kenyan who is in support of having this quarantine in Kenya, Honorable Speaker. And it is important for the government to know that the government exists for the welfare of Kenyans. And Kenyans know when their space is being cropped, Honorable Speaker. Honorable Speaker, the US budget in terms of health is 860 times ours. Their technology is better in all respects, including biotech, Honorable Speaker. They have better capacity to handle these kind of issues than Kenya. Honorable Speaker, while the CS is here, I would request him. Kenyans have spoken in one voice. We do not want that facility of Ebola here in Kenya. Please listen to the Kenyan voices. And Honorable Speaker, as the CS is here, the CS should actually bite himself and the obligations to what the Kenyans are looking forward to. Lastly, Honorable Speaker, in terms of the fragility of our health sector, and also listening to some officials from the US proclaiming clearly that they do not want any case of Ebola in their country, how reckless would the government be in doing exactly the same that which the country, that is the US, do not want in their soil? As Kenyans, we refuse. The government must listen to Kenyans and desist from having this quarantine in Kenya.
Yes, Mama Zamzam. Welcome to you.
Asante Mheshimiwa Spika, na mimi pia niweze kumwelezea waziri ndio Ebola na kujitayarisha ni kitu kizuri sana, kwa sababu hawa ni majirani zetu, wengine wanatuuzia kahawa umumu, wengine wanafanya nini, lakini iwe ni kama kukinga wa Kenya peke yake waziri. Lakini waziri, ikiwa na mimi nataka niwaambie hata wale wabunge walikuwa hapa, kwa sababu inasemekana hiyo ilipita hapa bunge hapa na Ndindi Nyoro ulikuwa hapa kwa hii bunge. Kwa hiyo ni vitu ambavyo mngeweza kukataa wakati ule ili isiweze kupita, mumpatie rais wakati mgumu. Waziri, mimi napenda kusema tu kama Mwamerika amekataa kule kwake, hapa Kenya tukubali, na nasikia katika counties 20 ambao walikuwa wamekubali, Mombasa ilikuwa moja wao. Kama mama Mombasa, sitaki kuona mzungu kule anatibiwa Ebola. Iwe kama itajengwa ni ya kuangalia watu wetu peke yake. Waziri, sisi ni kitu kizuri na tuna support kama tuwe na preparedness, manake sisi ni majirani, huwezi jua, na wanasema ina spray na unyevunyevu either through sex ama maji ama mate, hizo vitu tumesikia. Lakini sasa huwezi jua kitu yote za kutokea. Mheshimiwa Spika, kitu chochote chaweza kutokea. Na ikitokea iwe ni sisi wa Kenya peke yetu, isiwe kuwa ni mtu mwingine anakuja kutibiwa hapa, waende kwao ama warudi Kongo, kule walipata ugonjwa watibiwe Kongo. Asante sana Spika.
Yes, Ichungwa.
Honorable Speaker, first I don't know whether Honorable Zamzam, but the Deputy Speaker tells me Honorable Zamzam is actually right, because the Minister did
But
speak
that's
about
what the Minister said.
bodily fluids.
She simply said what the Minister said.
So bodily fluids
Except
could
the
be
Minister,
transmitted in many ways.
the Minister didn't speak in such good Swahili, or at all.
So thank you, Honorable Speaker. Honorable Speaker, let me first begin by thanking the Minister for this statement, because as Honorable Sarah Correa has said, is indeed very elaborate. And also to note, Honorable Speaker, that at the time this agreement was tabled in this House, I highly suspect the Honorable Aden Duale, as leader of majority, is the one who tabled this report in 2015. And the subsequent one tabled in 2022 was tabled by the Honorable Kimunya, my predecessor, as leader of majority. And it is true that the agreement between the Republic of Kenya and the United States was tabled, debated, and ratified by this House. Therefore, even as we speak, I know there's a temptation, Honorable Speaker, to speak to the gallery. And I wanted to begin by asking the CS to clarify just one thing that he has already said in his statement, but which many of us probably did not hear, or we have blocked our ears from hearing it. And because I have the privilege of having a copy of this statement here, Honorable Speaker, the CS did state that the proposed Ebola treatment and isolation unit at the Laikipia Air Base is part of the 23 similar units to be established in the country as part of our preparedness and response. So I would want first CS clarify to us and to the country that we are not establishing one isolation center
at Laikipia Air Base. The one at Laikipia Air Base is one amongst 23 others. Two honorable CS, including some of the ones, the minister did name a few, including one in Busia, was it Alupe or somewhere?
Order. Gone.
Two, Honorable Speaker, I want the minister to clarify to us and to the country something again that he has said in this statement, that this isolation center is not being established for foreigners exclusively. The minister has said that we have 2 Kenyan banks with Kenyans, our sons and daughters working in the DRC, some in Uganda. We have 450 of our armed men, our armed officers, who have given their lives to protect our lives in this country and the region, our region of peace. Should any of those 450 of our officers, our sons and daughters in DRC, God forbid, catch the Ebola virus, where shall we take them? Do we take them to America? Do we leave them to die in the Congo forest? Or do we establish isolation centers as any responsible government and administration would do to make sure that should you, Honorable Speaker, this weekend, I traveled to Rwanda. Honorable Speaker, I traveled to Rwanda as a Kenyan.
Yes, Millie, what is
Any
your point
other
of order?
Kenyan would have traveled to Congo.
Yes, Millie.
Sorry, Mr. Speaker, I had to interrupt the majority leader, especially now that I'm in leadership of the broad-based. But I'm just wondering, is the honorable member in order to imply that the United States of America is irresponsible by not setting up their own facilities in America, because Kenya is responsible setting up one in Kenya? Are you in order implying that America is responsible by not setting up in their own country when they are a superpower and we are a minion power? Are you, even Honorable Buru is still looking for power and you are bringing, are you suggesting that America is irresponsible by any chance?
Honorable Millie, are you saying that America is incapable of being irresponsible?
Mr. Speaker, I am actually asking for clarification. I am not saying, yes. Mr. Speaker, I plead the 5th Amendment. I just want to know from the...
Okay.
Honorable Speaker, in direct response to my sister, Honorable Millie, I am very well versed with our standing orders. I would never allude to the irresponsibility of a friendly nation on the floor of this House. I will not do that. But my point was, Honorable Speaker, back to my point, that as a responsible country, should we or should we not have isolation centers? Because this disease, we can't run away from the fact that it is there, and it is there in our neighborhood, in this region. Therefore, the question that I wanted the CS to clarify, yes. And I'm saying this, Honorable Speaker, deliberately in a leading manner, so that the CS clarifies for us and for the nation, this isolation center, from what I read in his statement, you know, Honorable Speaker, the problem is that members don't listen, like the member for Aldai is making noise and distracting me. And that is why maybe we may have missed some of the issues the CS has said. Because my understanding, and that is the clarification I sought, was that this isolation center is for preparedness, even to cater for Kenyans who may catch the disease, whether it is a staff of KCB, Equity Bank, or one of our armed officers who are working in DRC. Should they catch the disease, for instance, the military, the natural thing would be, if I was the commander-in-chief or the CDF, airlift anyone in an isolated manner to the airbase, to the isolation center there, to be treated there. But a truck driver, Honorable Speaker, who
Finish
catches
up.
the disease in DRC in Goma and probably is detected at the Busia border. Is there a facility at the Busia border? Because I have read about the laboratory testing there. Maybe among us, the 23, the CS should also clarify where are these other 23 centers to be established? Do we have them around the border with Uganda and where the trucks are passing, both legal and the illegal crossings? Because I see in his statement he's spoken about the legal crossings. But there are also illegal border points. What are we doing? Lastly, CS, on your preparedness, you have spoken about the 100 contact tracing. We're at about 100%, 87% on laboratory readiness, rapid response teams at 90%, infection prevention and control at 56%. But you have also told us that we have kits for the first 200 suspected cases. And that is where preparedness comes in, Honorable Speaker, and I hope the CS can tell us, have you then prepared? Because I've also seen your request. You are saying the first 100 cases will cost about 2.686 billion. Is this money already provided for in the budget? Or should we, as we go to the budget process, now factor additional resources for this preparedness for Ebola? Because the first 200, if we learned anything from COVID, to get from 0 to 1,000 cases would take less than 3-4 weeks. Therefore, Honorable Speaker, I will just seek those clarifications. And Honorable Speaker, let me just close by saying this. Ebola is a dangerous disease from what we have seen. But as a country, we must be prepared. And those isolation centers ought to be there, but they cannot be exclusively for others to use without Kenyans. And I think that's the very critical clarification. Because, Honorable Speaker, you know, in closing, this country, as Michael Joseph once told us, we have peculiar habits. Now, as politicians, many of us are very good experts in Ebola. And many Kenyans, almost all Kenyans are experts in Ebola. Let us hear from the experts, including the doctors here.
Waziri, let him respond to those. But before that, Minister, allow me to acknowledge your children, students in the galleries. In the Speaker's Gallery, we have Githunguri Girls School from Kandara, Muranga. We have St. Musingo High School from Ikolomani, Kakamega. Students, when your school is mentioned, you stand up to be acknowledged. In the public gallery, we have Kapsimbeyo School from Kuresoi South, Nakuru. USIU Africa, I believe there are students from Roysambu, Nairobi. Masjid Al-Amen Academy from Starehe, Nairobi. Gijiwe Methodist Fellowship from South Imenti, Meru. And Githurai Mixed School, Ruiru, Kiambu. On my behalf and on behalf of the House, we welcome the students, their teachers, and those accompanying them to Parliament. Minister, you can proceed to respond. Thereafter, we'll take another round, which will be the last one.
Thank you, Mr. Speaker. Mr. Speaker, I am ready to answer the valid questions by our honorable members, my colleagues. But Honorable Speaker, we are dealing with a very abnormal situation. And I want the House to look at the Public Health Act, Section 35 and Section 36. That mandates the Ministry of Health to take all the necessary action to protect and safeguard the safety of our citizens, our visitors, and all those who live within the borders of our country from any of the infectious diseases. To my sister, Honorable Sarah Koreri, But before even Honorable Speaker answer that question, first I think for information, we have 12 counties which are very high risk. These counties are Nairobi, Mombasa, Uasin Gishu, Busia, Kisumu, Bungoma, Trans Nzoia, West Pokot, Turkana, Homa Bay, and Migori. And this is because of the air, the road, transport, and the northern corridor. Then we have got high risk. The first one was very high risk. The high risk counties are 13. These are Vihiga, Kakamega, Nakuru, Kericho, Nandi, Kiambu, Machakos, Makueni, Kilifi, Taita Taveta, Isiolo, Elgeyo Marakwet, and Garissa. Honorable Speaker, again, for the information of the House, as of today, we have designated, verified 3 major hospitals as treatment centers. Kenyatta National Hospital, the Kenya National Police Hospital, MTRH in Eldoret. Secondly, we have also identified that we are in the process of completing the isolation, the treatment center of 2 hospitals in Busia. And I want to urge my sister, Mary Emase, even before COVID, the people of Busia and the country as a large, under the Ministry of Health, agreed that Alupe Hospital, a research center, is one of the very few infectious research hospitals. So in terms of qualification, that hospital is the most qualified because it's a research and infectious. Where have we done that? So in Busia, we have Alupe Sub-County Hospital, Referral Hospital, and we have Kocholie Sub-County Hospital. The reason why we picked on those 2, you know, that is where the biggest crossing.
For the record, it's called Kocholia, not
Kocholia.
Kocholie.
Kocholia. That is where the epicenter in terms of crossing from either DRC, our tracks, and the movement are. But we are doing assessment of these sites in the following counties. And Honorable Speaker, under the Public Health Act, we don't need to do public participation. We are not going to consult citizens. Even members of parliament here, when they fall sick, they rush to their doctor to make sure they get the best treatment. So this epidemic does not require any consultation. Tomorrow, God forbid, if Ebola is found in this country, this House will call me back here to this chair to ask me why are Kenyans dying. So before Kenyans die, before Kenyans are infected, we as a government have a moral, constitutional responsibility to protect both Kenyans and other people who are non-Kenyans who live within our border or who transit within our country. Honorable Speaker, on Laikipia Air Base is one of the 23 quarantine isolation center we are building. And we will not stop it. Why we are building in the air base, far from even, and there are a number of reasons why. The runway in Laikipia is one of the longest runway. That is where we have KDF medical team. That is why even our 450 Kenyans who are serving today under the UN, our special forces, the quick response unit. I'm the Speaker, I was the Minister for Defense. I went to Ituri. I know all those areas, those who have gone to Lumumbashi. Kenyans, the biggest hospitals in DRC are run by Kenyans, are owned by Kenyans. So we must protect, Mr. Speaker. So Laikipia will protect both Kenyans and the US. Honorable Speaker, when we had the COVID, when we had the COVID. And some of us were members of parliament here. The UN, the US, and many other international bodies built a hospital in Nairobi Hospital, a UN specialized hospital to deal with COVID. There was no noise that time. We have a responsibility to
Honorable
protect
Kiamba,
residents.
let him respond. to the
Honorable
questions
Speaker,
first.
on what the Secretary of State, Mark Rubio, said, that if it was said by the Minister, the Secretary of Health, I will respond. But I think that is an area for diplomats. The best person to respond to this House is the PCS. Because if it was my colleague, C.S. Kennedy, Alupe have answered very well. Laikipia we will build. Honorable Dini Nyoro, I think you are a bit very unfair. Because if all counties refuse to host isolation centers, the way you are suggesting, where will the Kenyans who will be infected, God forbid, go? I mean, as a leader, I don't think that way we can be responsible. And I agree with you, Madam Zamzam. Semen is part of the fluid. You are right. You are right. I saw people laughing at her. Body fluids. When we talk of body fluids, there are different types. Semen is one of the body fluids. So Honorable Ndindi Nyoro, I really want to urge you, my very good friend, if we say every county refuses, then where are we going to treat Kenyans? Are we going to treat them up in the air? We as a government have a responsibility. We can still even create another isolation center in one of our barracks in any part of the country. If today it was in Mordecai in Garissa, in Isiolo, so it will treat both Kenyans and foreigners. And please, let us not politicize it. The document that for the good of our country. It was good for our country. Kenya, Honorable Speaker, is number 2 in terms of healthcare delivery. South Africa is ahead of us. And very soon, even the US that you are praising, having a very good healthcare system, I can assure you, under the good leadership of President Ruto, we will become number 1 in healthcare delivery in another 10 years. Honorable Kimani, I have given all the 23 on our table of all the isolation centers, including let us not politicize the health of our citizens. And I want to ask a question, Honorable Speaker. A Kenyan who is in DRC crosses today. He passes through the scanners in Busia.
Minister, you are not here to ask questions.
Yes.
Give
No,
a hypothesis.
No, Honorable, I want to compare with the US one.
Yes.
If a Kenyan crosses and then the scanners don't detect as having Ebola, the incubation period for this disease is 3 weeks. He comes and joins his family and the community. After 2 weeks, he's found to be infected with Ebola. What is the damage that Kenyan can cause? You know, we must look at how to save the nation. So we are more concerned about Americans coming, but we are not concerned about even the thousands of Kenyans, truck drivers who pass every day, go on there. We are just focused. Let us not make, Honorable Speaker, this thing a more of the Kenya Kwanza administration. The health of the citizens of our country is a collective responsibility. Those in government, those in the opposition. We can play around with anything else. Honorable Speaker, the Honorable Sahara Korede, there have been 16 other previous Ebola outbreaks in our country. This is the 17th one. So it didn't come with this government. COVID was not with this government. So, and then Ebola and all infectious diseases, they don't know borders. They cross. They can cross from anywhere. And we must make sure the isolation and treatment centers, including the one in Laikipia, are securely controlled. The environment, even within the Laikipia, in fact, because it's a military camp, is even more secure than the ones we are putting in the counties. Any one of us can be infected with Ebola, God forbid. Healthcare workers will be trained. Waste management will be done. Honorable Speaker, Honorable Mary Emase have answered a question. Honorable Ndindi have answered this question. I think there was Honorable Zamzam under the International Health Regulation Act of 2005, which this House has adopted. We are obligated. We are part of the global community. We are part of the global health security. Kenya is celebrated as one of the key leaders in global health security. We are obligated not only to take care of our own, but we are obligated to treat, to detect, and make sure even those who are not Kenyans, but who are within our border, must be taken care of, so that we are not safe until all of us are safe. I think the Honorable Deputy Minority Leader, my old colleague, the facility is receiving patients. What we have passed in the House was on infectious, biosafety, biological, which were all stipulated in the agreement. But I still have copies at the Ministry of Health. So quarantine is not only for Americans, even Kenyans will be isolated at the facility, and I have highlighted the huge Kenyan population in DRC and Uganda need our support. Honorable Speaker, I think most of the questions I have answered. The last one is, let our preparedness and response be dictated by science and not by politics. How we respond, how we protect our citizens from Ebola, which has no vaccine, it should be guided by science, but not politics. We'll go back to politics when we know the country is safe, the citizens are safe. And Honorable Speaker, finally, Nairobi is the center of the diplomatic community. The UN at Gigiri, the only one in the global south, extra 8,000 staff have been brought in the last 3 months. This is where we have the multilateral institutions. This is where we have JKI last year received 9 million visitors and about 3 million tourists. All those, plus our citizens, we must be cognizant of their health, Honorable Speaker. So like Kipia, Honorable Korere, the one on the land taken, I think it is this House again which has passed the agreement between us and our UK partners. So there's nothing illegal the government has done. Let's all of us be the voices and help us communicate to our constituencies that Ebola, and particularly this variant, is dangerous, it has no cure, and all of us must be vigilant and alert, and those of us in the health ministry, we will protect our citizens.
Order, Mary Emase. What is it, Emase? He has responded to your question. What is it you want to clarify? You want to
May I have
recount
the
what
mic?
you
Thank
said?
you, Honorable Speaker. Honorable Speaker, I do not want to be misunderstood. In Teso South sub-county, I have 2 sub-counties. The only hospital I have offering the normal medical services to the community
You said that
is
already.
Alupe. Honorable Speaker, my position and the position of the people I represent is that there is enough land in Alupe. Let the ministry build an isolation center for quarantine purposes,
Away
from the hospital,
Point
but
made.
not to take the hospital for that purpose. That is
Point
what
made.
we are objecting.
Point made. You have made your point, Mary, and you and the minister are saying the same thing. Honorable members, order. Honorable members, the time I allocated has been overshot Just hold your horses. Has been overshot by 9 minutes. Given the interest, and whoever I give, you just ask a question, no speeches, so that we can take another 10, 15 minutes, and you're obligated to extend from 10 by the time we are consuming now until we finish. Okay, I will give 3. Okay, my minority leader, Junet, you will be number 1 on this side. Number 2, I'll give Honorable Kiamba Susan. That is number 2. Number 3, I'll give the Chair of Health. This side, I'll give Professor Jaldesa, number 1. I'll give my Deputy Speaker, number 2. And I'll give Madenge, number 3. I've already given members of your committee. So let's start with number 1 in quick succession. Junet, I'll come to you. After Junet, Kiamba, after Kiamba, Nyikal, in that quick succession.
Mr. Speaker, thank you very much for giving. Mr. Speaker, I want to ask this. But having noticed that, Mr. Speaker, there is a ratified document by this House. Mr. Speaker, members should take very serious when the Speaker is putting a question. Of as many of that opinion say, you just say, you don't know you are ratifying something that is going to bring a disease. So be careful next time. Next time, be careful, please. But, Mr. Speaker, my question is, I have condensed this thing into 2 aspects, Mr. Speaker, and I want the Minister to clarify. What Kenyans are grappling with, Mr. Speaker, is how does the government intend to safeguard Kenyan sovereignty and decision-making authority? Just explain to the House how you have safeguarded your sovereignty and your decision-making. And then lastly, whether it is the foreign governments that will decide who gets admitted to those facilities, and whether you have done public and security assessment, and whether you have done that report public. If you answer those 4 questions, then Kenyans will be safe. Thank you very much.
Next, Kiamba.
Thank you, Honorable Speaker. I think my first one was point of order. Is it in order,
there is no
Honorable
first
Speaker?
one. I've given you to ask a question. A point of order arises when a member is on the floor. There's no member on the floor. Ask the question. If you don't, you yield the floor.
Thank you, Honorable Speaker. I would want to ask the Minister, now that Kenyans have spoken loudly and clear, that the context has changed and we do no longer want this center, what is his recommendation? Does the wishes of Kenyans become irrelevant, or can dynamic Kenyans think, or once something is passed in this parliament, it's passed in heaven? Thank you.
Yes, Dr. Nyikal.
Thank you, Mr. Speaker. Mr. Speaker, let me ask one. Who will be admitted in this facility, and what would be the criteria for admission? 2, will people who are already sick be transferred to this admission? 3, will people other than Americans be admitted in these institutions? And on the contrary, will Americans be admitted in the other 23 institutions that were put in place? And why didn't we...
Nyikal, I gave you an opportunity for 1 question.
Okay, then
then
let me just, I've asked 3, I'll leave it there. But let me make a comment about the agreement, because I know the agreement, I remember the discussion, and I've had time to look at it. The agreement is a general agreement, Mr. Speaker. It is not just Ebola, it is other diseases, it is nuclear materials as well. And in every point in the agreement, it says with mutual agreement. At every point in that agreement, it says with mutual agreement. So, Mr. Speaker, I only wanted to make those 2 points.
What is the point of order, Carolo Mondi? What's your point of order?
Honorable Speaker, is it in order for the chair of the Health Committee to mislead the House and the nation that in those two agreements, which I have here and which I've read, there's a clause that provides for the establishment of an isolation and treatment center in case of any outbreak of Ebola or any other disease? There's none. I can read them out
He
for
never
you. If
said
it is,
that.
show us, tell us the article.
Order, Honorable Carolo Mondi. Order.
Mr. Speaker, I say,
Dr. Nyekal, I heard you clearly. Take your seat. Take your seat. Carolo Mondi just wanted an entry to make an inflammatory statement. Yes. You never said that. Jaldeza? Jaldeza?
Here, thank you.
Order, Carolo Mondi. Nyekal never said what you are saying. I'm closer to him. And I listen to all of you.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. I want to tell the House that Kenya is lucky to be having the leading and the best researchers in this region. Kenya has been taking leadership in leprosy research at Alupe, which was an isolation center. Mr. Speaker, when HIV started, HIV patients were actually isolated until people learned that it's not such contagious disease. And it was based at Cambridge, and it has done very well. And the research work which was done and the researchers were left behind for the country. Mr. Speaker, last COVID was such a threatening disease that we were actually trying to look for beds for patients who have COVID. And people are going to all sorts of funny places, including some hospitals in Kibera, and it saved people's lives. But the good thing, the Nairobi Hospital East Wing, was left behind for the hospital
Yes,
and for
Orero,
the country.
what is the point of order?
Oh.
Mr.
He has a
Speaker,
point of order. Let's hear him.
is it right for my colleague to refer to Kibera as funny hospitals, even in Kibera? Is Kibera not a constituency?
Yes.
It's demeaning my constituency.
Go on.
Mr. Speaker, Kibera is a constituency, and it has the highest concentration of people in this country, and it deserves better services. Mr. Speaker, my point is this. Mr. Speaker, when this Ebola virus outbreak ends, what will be the benefit left for the country? That now we can say the country benefited financially in terms of resource and research from this outbreak.
Deputy Speaker.
Honorable Speaker, I would like the Cabinet Secretary to confirm to the members here who have objected to having the quarantine centers in their own counties that in our case, Uasin Gishu County is one of the quarantine centers. And because of our close proximity to Malaba border, we can be at risk and our people can be at risk. And that is the reason why we are not politicizing it. We are welcoming it because we know they'll take the necessary steps to make sure that we don't risk. And also, I want the Cabinet Secretary to also confirm to members that you're not going to endanger our health because of politics. This is a highly infectious disease. In fact, it can warrant calling of a state of emergency in the country. It is not a choice for people to make or a court process. The moment the country, if people's health is endangered and livelihoods are at risk, we might not even be, you're not supposed to even question. So I think it's important to know that that is not something that is within our prerogative to say, I don't want this hospital, or I do not want that hospital. And for Honorable Karoli Omondi, if you look at page 5, you will see the participants intend to collaborate in the following areas: surveillance and outbreak response. What is exactly happening now is surveillance and outbreak response. All the steps that the Cabinet Secretary has read here are exactly those. Thank you, Honorable Speaker.
Madenge.
Thank you, Honorable Speaker. Honorable Speaker, I want to draw the Minister to the attention to the first agreement that was tabled in this House for ratification. On page 6, Article 3, Executive Agents and Implementing Agreements. For the United States, the agent responsible is the United States Department of Defense. And therefore, Honorable Speaker, the Minister cannot fail to respond to the words of the Secretary of State in saying that the United States will not allow Ebola-infected patients into their borders, because that is the issue that Kenyans are talking about. In Kenya, it is the Ministry of Health. So, CS, you cannot abdicate responsibility. Honorable Speaker, my second content, again on the agreement, is Article 11, page 11, that this agreement shall remain in force subject to Article 13.2 for a period of 5 years from the date of entry into force and the ratification by this House. There was no express, although there is a provision in 3, this agreement may be renewed for an agreed period upon mutual consultation and consent. In the approval provided by this House, did this House envisage that when I am talking about the approval by the House. The approval by the House. In the approval by the House, did this therefore mean automatically that then when the Cabinet then renewed, that extended the approval granted by this House? Lastly, Honorable Speaker.
I gave you an opportunity for one, Madenge.
Allow me just one. The committee recommendations, Honorable Speaker. Number 5, the implementing review committee be constituted and should develop a mechanism for reporting back to Parliament on the status of the implementation of this agreement. How many reports, Honorable Speaker, have been brought to this House on the implementation?
Minister, before you answer, let me give the minority whip, Millie. Millie.
Thank you.
Ask one question only.
Thank you, Mr.
Don't
Speaker.
make a speech.
No, I actually wasn't going to give a speech. You are the one prompting me. But I'm not asking.
I will stop you if you
I'm
try.
not asking. I'm not going to.
Go ahead. Millie.
Thank you, Mr. Speaker. Mr.
I've
Speaker.
given Millie on account of being your leader. Go on.
Thank you, Mr. Hey. Mr. Speaker, you can see Suberians are disturbing each other. Mr. Speaker, mine is really very, very simple. And if you listen to the concerns, Kenyans are not really too worried about setting up of centers that protect Kenyans. Kenyans are worried about the statement that was made by by Rubio from the US, that seems to imply that this facility is for Americans to protect Americans so that the infected Americans do not touch American soil. And Mr. Speaker,
if you want my opinion, it was a very irresponsible statement.
Yes, it was a very responsible statement. Yes. And all I want to ask Honorable Duale, even though he's throwing back this to the Ministry of Foreign Affairs, is what is he doing to deal with this issue squarely with America? We have seen our counterparts in West Africa when they're being bullied by the French, that they take a firm position and say no. So what are you doing to tell America that they are a friendly nation and we are friends to them, but we cannot allow a situation that compromises our own nationals to maintain that friendship. We cannot allow such things in Kenya.
Thank you. Last, Bukose.
Thank you, Honorable Speaker. Honorable Speaker, I want to confirm that when the report was tabled in 2016 by the Committee of Health, I seconded that report, and the chair was Honorable Nyamai. What I wanted to ask the Cabinet Secretary, what I wanted to ask the Cabinet Secretary, why are you laughing? No, it was Honorable Nyamai.
If it's a statement of fact, it remains a statement of fact.
It's a statement of fact.
Yes.
Honorable Nyekalu was a member of the committee. And Honorable Speaker, one funny thing about that report is that when we put into the dailies to ask for public participation, there was no single memorandum from the public. Nobody wrote anything. And I think Kenyans also need to be responsible. They must be able to look at some of these when the parliament puts a document for opinions or memorandum in the dailies, that they should also be able to give inputs. And therefore, honorable members who are not members of parliament by them cannot say that they were not Kenyans at that time. They needed to have even put their input. What I wanted to ask the Honorable Minister, Mr. Speaker.
Kajiado South, Parashina, what's your point of order?
Mr. Speaker, is a member in order to come to maybe to relate the public participation by then and what is going now is Ebola. So we're talking about the Ebola, the foreign, whatever is happening is the question is about Ebola. It's not about the agreement by that time.
I think you're wasting my time because you don't understand. This is the problem of not understanding what we were ratifying. Honorable Speaker, what I wanted to ask.
Honorable Junet, what is it? Hold your horses.
Mr. Speaker, Dr. Pokose should have given us more information that Dr. Nyamai was the chair and he was the vice chair.
Yes.
He put it like he was a member.
No, I was a vice
but Mr. Speaker, just to...
He said he seconded.
Yeah, but he was the vice chair of that committee.
Yes.
Mr. Speaker, the fact of the matter that is coming out today here is that Parliament ratified this treaty. Yes. Mr. Speaker, yes. Let us be open to Kenyans. We gave them an opportunity to give their public participation. We ratified. We told Americans, do what you want to do. Yes. And when the Speaker says, as many of that opinion say, aye, don't cheat Kenyans.
It is true what minority leader is saying. We ratified the agreement as the National Assembly. And it became the law of Kenya because by ratification, what it means is that it becomes part of the law of the country.
Ask the question.
My question to the Cabinet Secretary. Yes. You know, when people are raising about the isolation centers being set up in certain areas, does it mean the whole hospital becomes an isolation center, or there is a specific area within the hospital that is set up as an isolation center? Because I think that is what Kenyans need to understand publicly, so that, like my colleague, when we talk about Koicholwa or Alupe, thinking that the whole of Alupe is an isolation center. So I think the Cabinet Secretary needs to clarify. Even as we speak of Kenyatta having an isolation center, what does it mean? Thank you, Honorable Speaker.
Minister, can you answer all those in 5 minutes?
Yes, Honorable Speaker. Honorable Speaker, let me start where Honorable Pukose left. That isolation centers are not part and parcel of the hospital where citizens access for other services. And it's not something only with Ebola. It is a standard procedure when an infectious disease happens, whether it is Marburg, Mpox, name it. So even in Alupe, in any facility, even in Laikipia, it is very far. Those who come from Laikipia know the expansiveness of Laikipia Air Base. It is far from the base and all the facility in the base. So no hospital. Honorable Chair, Honorable Junet asked whether the issue of our sovereignty. And in my statement I say, and I want to emphasize, that international cooperation does not mean surrender of our national authority and sovereignty. All public health decisions within Kenya remain under the authority of the government of Kenya. International partners and governments, including the US, they provide technical assistance, they provide health commodities, they provide finance, and I want to thank the US government, the only one so far, apart from WHO, who has provided 1.7 billion for just only Ebola. They provide training and logistics support within the framework approved by the Kenyan authorities, and which is consistent with the Kenyan laws. So, Honorable Junet, I want to assure you that all the facilities which are being established, including the one in Laikipia, for the protection of the people of Kenya and all persons within the Kenyan borders, they are not foreign facilities. They are not exclusive facilities. They are not facilities reserved for any nationality. They are public health assets established and coordinated under the authority of the government of Kenya. Honorable Speaker, Honorable Sholei, I think, made it very clear. We have a moral responsibility. Every county where we are setting isolation, quarantine, treatment centers, they are based on science and the law. And it's done by experts who are Kenyans. Honorable Madenge, you are a member of the health committee. You know that I have never shied away or abdicated my role as a minister for health, and I'll never do it. But this agreement first was signed by Minister Macharia. It was again extended by my very good colleague, the current Minister for Agriculture, Kagwe. And when an extension is being done, it only requires one ratification by the House. So the House has passed, the way we have passed many other many other agreements, and this is all to protect our people. Honorable Nyikal, Kenyans will have a priority in admission to any of the centers, including Laikipia. And we should not be very much preoccupied just one center. I don't know what is so fast about Laikipia. We have 23 centers. Even in my own backyard in Garissa, it's one of the counties. Tomorrow, if we agree to put it, and we're going to put it, the people of Garissa will be saved. So we have 23 centers, Laikipia included. And Kenya is one, and let us promote one Kenya, one health, and we protect Kenyans regardless of where they come from, regardless of their counties. We need the isolation quarantine centers, Honorable Speaker, first and fundamentally, morally and constitutionally, to protect our citizens, Kenyans. Again, also to protect other people who live or who come through our country. But for our partners who have signed the agreement, they can access these centers. Americans can access any of the centers. Of course, Laikipia is one of the centers they have jointly worked with the Kenya Defense Forces. Honorable Speaker, Honorable Susan talked about loud and clear. I don't know, I can't answer what is loud and clear, because Kenyans, when they want to make their choice, they do it through a referendum or through public participation, not through demonstrations. And the health of our citizens cannot and will not be decided by 3, 4 people, 10 people who will demonstrate outside MOH. Tomorrow, if Ebola, God forbid, finds itself in our country, the person and the people who will be held responsible is the current government. And we must do whatever it takes to protect the citizens of our country. Honorable Speaker, Honorable Jalesa and Honorable Jalesa, I think, he said we did this. We have the best capital.
Jaldesa didn't ask a question.
Yes,
He
Honorable
made a
Millie.
statement.
Please, my good, we join Millie, Honorable Millie, together to this House of Excellency, Honorable Speaker. Don't compare us with some other places. We are ahead. We are number one in the healthcare. We have a very good relationship with the US. They spent $8 billion. Today, the gains we are proud of in HIV, in AIDS, in malaria, in the capacity of the laboratories in Kisumu, like Cambry, CDC, Walter Reed in Kericho, those were built because of the partnership we have with the US government. For Mark Rubio, I think Senator Mark Rubio, the speaker, has spoken about it. He's a former long-serving Kenyan foreign minister. He understands diplomacy better than me. I've never been a diplomat. Thank you, Mr. Speaker.
We'll end there. Yes, Nyekal. Which one?
Will people who are already sick where they are be transferred to this unit? Mr. Speaker, I ask that question because science and international practice is when people are sick of a disease in a pandemic or an epidemic, you treat them where they are. You don't move sick people to a place where there's no disease. I would want a question to that. And Mr. Speaker, let me also say, this agreement does not oblige the government to put an Ebola unit. This agreement was general.
Yes.
Honorable Speaker, even to Honorable Nyekal, even here members are sitting. We transfer our patients from one hospital to another hospital. Why do we do it? Because we want them to get better care. The healthcare system, and I don't want to be misquoted, the healthcare system there and the healthcare system for a Kenyan who gets sick. I am sure all of you sitting here, if your next of kin gets Ebola in DRC, the first thing you'll do is to bring to a better healthcare system in Kenya. Honorable Speaker, and I don't want to talk about hypotheses. As of today, there's no Ebola outbreak. So don't take me to a situation where I discuss about people who are infected with Ebola. When that comes, then the House can call me back and ask me that question. That, are you bringing in people who have Ebola? As of today, there's no Ebola patient in Kenya. When that time comes, I am around, the House can call me back.
And there, honorable members, we'll now go back to order number 8. It is now 4, you'll call it, well, it's now 4:23. This second allotted day will end at 7:23. And the next allotted day will end at 10:23:25. Call out the next order. Minister, you are released to go back to your office.